So in this diagram now, I've just drawn this in order for you to understand the homunculus and the reason why you need to, how to locate the lesion, and the reason why you need to use the appropriate terms, disproportionate and proportional hemiplegia. Is it clear? Now let's visualize. You need to know that what in this diagram, you need to know that in the central homunculus, the legs are located medially, the penis is here, then you have the thorax here, then you have the face at this level, and then you have the hands which are more external, and this is the same side. So this is the right and the left side of the homunculus, and it's going to decussate. You're going to have the third cranial nerve that is going to decussate at the level of the midbrain. Is it clear? Then you have the cranial nerve 7, which is the fascial nerve, which is going to decussate at the level of the pons. And then we have the cranial nerve 12, which is going to decussate at the level of the medulla oblongata. And then lastly, the body nerves, the nerves that are going to be at the level of the body, are going to decussate at the level of the pyramid. Yeah. Sorry for that. Here is going to be the pyramid. It is going to be located at the level of the lower medulla. Now, let's come back. If you have a patient that has a proportionate hemiplegia, when you have a proportionate hemiplegia, meaning that what? It is both the upper and the lower limb. You know that here it is all the body. Since here is all the body, means that it is both the upper and the lower limb that is going to be affected similarly. So when somebody has a proportionate hemiplegia, the lesion is going to be located here, because here is the smallest area that contains most of the fibers. From the upper limb, which is the hand here, is going to contain the head here, is going to contain the thorax here, the penis, and all. So we have all the hemicide of the body is going to pass through this small area, which is going to be the internal capsule. Is it clear? So when you have a proportionate hemiplegia, you need to know that generally the patient has a lesion at the level of the internal capsule on the contralateral side. Is it clear? It means that what? If I have a lesion here, you see, when I have a lesion here, it is going to be moving. You see that this side of, so this eye here, is it clear, is going to be affected. This contralateral eye, you have the lesion at the level of the right side. It means that the contralateral left side is going to be affected. So for this, you have this cranial nerve palsy. Is it clear? But generally, we need to know that what? The patient is not going to have a cranial nerve 3 palsy, because at the level of this nucleus, this is also gaining some fibers from this one here. So you are not going to have any cranial nerve 3 palsy generally when you have a lesion at the internal capsule. Now, the second thing is that you can have also a fascial palsy. A fascial palsy, you're going to have a right central fascial nerve palsy. Is it clear? You are going to have a medulla injury. So you are going to have the hypoglossal nerve injury, and then you have all this body is going to be injured. So you are going to have a proportionate hemiplegia on all this side. Is it clear? On the left side. Now, when you have an injury only here, is it clear? You see that here the fibers which pass here are the fibers that are only containing the lower limb. Is it clear? Since the fibers are only on the lower limb, this patient is going to have a disproportionate hemiplegia, which is more going to be predominant on the lower limb. Basically, so this patient is going to have, when you have an injury at the level of the lobes, you are going to have a disproportionate hemiplegia, which is so it's going to be, you have a medial lobe injury, it's going to be a disproportionate hemiplegia, which is going to be more where at the level of the lobes. So it's going to more involve the lower limb. Now, if somebody have an injury here, is it clear? It means that the patient is going to have a disproportionate hemiplegia, which is going to be more predominant on the face and also on the upper limb. Is it clear? So generally that's that. Now, those are the different things that you have to visualize, and all this is going to resolve when you have injury all through here. You're going to have what is called the pyramidal syndrome. Is it clear? Because all these fibers which are moving here are the pyramids, so you are going to have the pyramidal syndrome. Is it clear? Also called the upper motor neuron syndrome. Is it clear? Now, the next thing is when you are at this level here, the midbrain, the pons, and the medulla is called the the brainstem. Now, let's say that you come and you have an injury here. Is it clear? If you have an injury here, it means that what? This cranial nerve that was supposed to supply here for the oculomotor nerve on this side, on the right side, is going to be affected. But the body is going to be affected on the left side. Is it clear? So when you have a patient that has an ipsilateral cranial nerve 3 palsy and a contralateral paralysis of the body, is it clear? It is going to be called a brainstem syndrome. Particularly, this brainstem syndrome is called the Weber syndrome. Is it clear? So when you have a patient that has a, let's say, a right cranial nerve 3 palsy, and then he has a contra, in order for you to understand best on the cranial nerve palsy, you need to go back on your tutorial at the level of SchrDbb TikTok in order to visualize that. So when you